I'm Karen Day with Daybreak Therapy and Training, and I just want to take a few moments today to talk with you about what we mean by clinical counseling hypnotherapy. So clinical counseling hypnotherapy is a reference to trance-based interventions in the clinical counseling context. A trance-based intervention is any kind of intervention that activates a lower, slower state of brainwave activity. Now, all kinds of groovy things can happen in this lower, slower state of brainwave activity. For example, you're better able to integrate your observer mind with experiential-based ways of interacting with the world. And you're better able to integrate core teachings that you might be focusing on in psychotherapy. You're able to go inward a little bit more to access inspiration and bursts of creative messages that are coming from a deeper and wiser place within. When people hear the word clinical hypnotherapy or hypnosis or clinical hypnosis, and I use all those terms interchangeably in the work I do every day, but when people hear those terms, they sometimes have this reaction like I'm going to say with a pendulum, look deeply into my eyes. You are getting sleepier. Your eyes are getting heavier and heavier. You will obey my command. You will stop having panic attacks. And it doesn't really work that way. And that's not going to be effective. And that's not what clinical counseling hypnotherapy is about. You'll often get the other reaction from people who are kind of interested in this work. And they'll say something like, you know what? I've tried CBT. I've tried narrative therapy. I had a Gestalt therapist for years, and I really just need a hypnotherapist to help me clear out and blast out some of these unhelpful beliefs and clear out and blast out these unhelpful memories so I can move on with my life. And that's why I need hypnotherapy. And that's not what this is really about either. That's kind of a quick fix look at deep communication with your creative unconscious. So it's not really about getting rid of anything. Although with clinical counseling hypnotherapy, there's often an exploration of deep-seated core beliefs. And there is great transformative work to be done in that area. But it doesn't stop there. So I think clinical counseling hypnotherapy can be radically transformational because at its core, it taps into resources that otherwise are going to simply lie dormant. And you can't tap into those resources through conventional talk therapy. You can only go part of the way. And so hypnotic interventions and bringing clinical hypnosis into psychotherapy is really going to seal the deal for you in terms of long-term change and can be a much more enriching experience for you in terms of long-term shifts in consciousness, changes in perspective, changes in the way you engage with your life.